It's time for Medical Moments with Covenant Healthcare, and today we're talking about the importance of cancer screenings at any age. With me here is Dr. Joseph Contino, breast surgeon at Covenant Cancer Care Center. Thanks so much for being here today. So today's topic is very important because Breast Cancer Awareness Month. So first, tell us why it's so important for people to get their yearly mammograms and cancer screenings.
Well, we've established that there's improved survival in younger age groups, but today I wanted to focus a little bit on patients who are over 70 because I feel the message has kind of been lost in them. When we did studies to demonstrate that you can decrease breast cancer deaths in screening population, we kind of left out these 70-plus-year-olds because we just never looked at them and didn't think they were going to live that long. In today's world, you know, a woman who's age 65 in this country today is expected to live until age 87. And so I believe that breast cancer screening is very important for this age group. And even though we don't have any data on it, we are making improvements all the time in cancer care for breast cancer in this patient group. And so I think it's extremely important for the patient to discuss with their physician getting a yearly screening mammogram.
So speaking of that age group, what are some of the common misconceptions about cancer screenings over the age of 65?
It's just that it doesn't change their survival very much, but it does. I mean, we are improving the overall health and survival of people in this country all the time. We know that breast cancer survival, if we look at it day-to-day, is improved in that age group. We know that recurrence rates are decreased. But what's really important in that age group is that people in this age group are still busy living their lives. I mean, I have patients in this age group that are working, they're traveling, they're busy deer hunting in this area, they're busy taking care of their families and their homes and their property. And if we can catch breast cancer earlier in this age group, they have a much better quality of life most of the time. I mean, it's just so much better for them. And my patients are surprised when we do catch it early and I'm able to treat it and I say, look, this is how it's going to work out for you. You're going to be back on your feet. You're going to be doing this and that. They come back and they say, you know, I didn't believe you, but you're right. I mean, I'm doing fine. There's
a lot of life left to live. So what do you recommend to the viewers who are over the age of 65?
I recommend that they talk to their physician about yearly screening mammography. That has to be taken into the context of other health issues and everything else. But if they have a good 5-year survival and they really are interested in trying to reduce a lot of extensive treatments that come with finding a breast cancer later, they should strongly consider getting their mammogram early. And it's not that difficult, and the newer mammography techniques are easier on patients. Patients are telling me they're easier to get done. And we're finding breast cancers early if we get a chance to find them in the vast majority of patients. And I do feel that this is a group that benefits greatly from finding breast cancer early.
So what do you want the senior population to know about breast cancer care at Covenant?
We are a multidisciplinary team that adheres to national guidelines, but also looks at every single individual patient every Wednesday at a breast cancer conference, and we tailor their cancer care to their cancer, to their age, to the patient specifically.
Well, thank you so much for being here. We appreciate talking to you. And if you want any more information about this topic or other medical moments of Covenant Healthcare, be sure to check out the hot link section of WNEM.com.